Welcome to the YouTube series on mental health awareness, which Manthan has started since last one month. We conduct a session every week on different topics that are relevant to be understood for the mental health of every child and every adult in life. Now, this is the third session uh, which we have started today, and which is on somatization. Now, what is somatization? We have to understand first what somatization is. So, somatization disorder, okay, is a form of mental illness that causes one or more bodily symptoms, including pain. The symptoms may or may not be traceable to a physical cause, including general medicines, medical conditions, or other mental illnesses or substance abuse. Okay, but regardless, they cause excessive and disproportionate level of distress in the individual. So, if you really gather that there is somatization in any individual, it is important that some help is available to that particular individual. Now, children frequently complain of various somatic symptoms, often clearly related to emotions or a misinterpretation of normal bodily phenomenon. Okay, when it is recurrent and disrupting the child's behavior or functioning, it is brought to medical professionals to do something. Vast majority of these cases are managed by primary care physicians and pediatricians, who can operate as an efficient filter by not escalating the family's anxiety and minimizing doubts. Okay. Now, the physical symptoms of somatization are that they suggest physical disorder which are not demonstrable or organic findings or known to physiological mechanisms. Okay, and for which there is positive evidence, okay, or presumption that the symptoms are linked to psychological factors or conflicts. Okay, such patients go to different doctors with the only hope that they will get relief someday. We all experts in the field of have thoroughly checked and investigated and find nothing abnormal. Okay, do not worry about it purely psychologically, but it will only has to be addressed at the right time when it is found. The importance of these symptoms are that they cause considerable distress and suffering to the patient and the family. It is confusing and challenging for medical professionals. It is an enormous drain on financial resources of the family. Proper information and knowledge is not available about the treatment of this particular disorder. Most of the medical professionals diagnose these cases as functional by exclusion, but one must realize that these are real problems. Finding the underlying psychological root is most important part of the process. Adult cases of hypochondrias and somatization often have their onset during childhood and adolescent ages. Okay, delay in diagnosis and proper therapy in time, as each consulting doctor tries one's best before giving in. So they are subjected to too many investigations, which is a big drain on the individual and on the financial resources of the family. Now, what kind of disorders really occur when there is somatization in the individual? There is recurrent abdominal pain, there is headache, there is limb pain, muscle ache, or polysymptomatic presentations may increase with age. Symptoms related to number of bodily systems over a period of 1 year also are some of the disorders of somatization. Complaints are equal in girls or boys, so it's not that girls get more and boys get less until puberty. Then girls predominate. So earlier girls and boys get same number amount of symptoms, but as girls go through a menstruation period or after puberty, there are more symptoms amongst girls than boys. Family members tend to have same symptoms as the child has. There is family tendency to use physical symptoms as a way of stress reduction, and they are high users of healthcare services. Sexually and physically abused children tend to present with tendency for somatization. Now, what are the symptoms underlying due to the psychiatric disorders? Now, sometimes there is hyper anxiety in the individual, palpitation, respiratory symptoms, frequency of urine or stool could lead to a somatization disorder. Depressive disorders like reduced appetite, sleep difficulties, and other behavior problems. There is also if there is a family history of depression also, the individual may really show up some symptoms of somatization. Now, there are families who have the same characteristics if they have somatization. So, those symptoms could be overly anxious and preoccupied with sickness, disorganized and chaotic family relations with stress is manifested in somatic form. Now, don't forget to like and subscribe to our channel if you feel that this session has been useful. We will back with another episode on mental health series of adolescents. Till then, stay tuned to the channel. Thank you very much.